In this video, we're going to do some warm-up exercises for your back to get the circulation going, and then we'll do a couple of back stretches. And I will tell you some very interesting things about back pain that you probably don't know. My name is Hilma Volk, and I was a licensed massage therapist for over 23 years, and I'm also a certified nutritional coach. And I'm also the creator of the self-help program Carpal Tunnel Master. And you can read more stuff in the description below. Now, in this video, we're going to do some warm-up stretches, and I'm going to voice over what I show you because it's hard for me to do two things at once, like walking and chewing gum. And so I am going to tell you some very interesting things about back pain. In this warm-up, you want to stand at a neutral position with your feet shoulder-width apart and swing gently side to side like I'm doing. Follow along with me. Both sides for 15 times. What I'm doing with my fingers is counting. Haha. This gets the blood circulating in your back. Now, what I'm going to tell you about back pain comes from the book Foods That Fight Pain by Dr. Neal Barnard. Now on Amazon.com they let you look inside the book to see a portion of it, and fortunately what I'm talking about is found in the preface of the book, so you don't have to buy the book to read what he talks about back pain. And he tells you a lot more than I will in this video. He wrote the book in 1998. And treatment of back pain had mostly consisted of anti-inflammatory drugs, heating pads, bed rest, physical therapy, and all too often surgery, but research showed that these didn't work very well for most people. Now I'll continue this after we start on the next warm-up. In this second warm-up, you want to start out with your hands on your shoulders, feet shoulder-width apart, and don't do anything that makes you feel worse. You want to inhale and bend forward at the waist as you exhale. You don't want to be bending your back. Inhale, then exhale as you come up to a neutral position, and repeat this 5 times. And now I will continue to tell you what Dr. Neal Barnard had to say about back pain. Doctors were finding that a lot of people who had back surgery were in just as much pain or even worse than before the surgery. And a 1995 study wanted to find out why. It had long been known that degenerated discs cause pinched nerves, but they wanted to know, why did discs and vertebrae degenerate? They did autopsies on people who had serious back pain but had died of other causes like accidents or whatever. In most of the cases, the arteries that fed the vertebrae, and therefore the disc as well, were either partially or totally blocked. And these were clogged by plaque, the same kind of plaque that blocks the arteries to the heart when you have a heart attack, or clogs the arteries to the brain when you have a stroke. The blood supply that is so essential to carry the oxygen and nutrients to help the spine repair from its wear and tear, they're cut off. And also waste products build up because they can't get out efficiently either, and that is so irritating to those sensitive nerves. The autopsy studies showed that the greater the artery blockage, the worse the degeneration of the discs, making it more likely that the vertebrae would shift, that discs would rupture, and nerves would get pinched, causing chronic pain. Well, I will continue this discussion about the back after we get started with this next warm-up. In this next warm-up exercise, you want to stand in a neutral position, feet shoulder-width apart. Inhale and then exhale as you lean back, starting at the base of your neck and going down to your lower back. Then inhale, exhale as you return. And do this 5 times. Now the purpose of these warm-up exercises are to get your back muscles ready for stretching. A lot of times it's tight back muscles that cause the stiffness and the aches and pains in the back. And even if you don't have back pain, it's good to keep your back muscles loose and supple. And if you ever have a back adjustment by a chiropractor, having loose muscles will make that adjustment so much easier. Getting back to Dr. Neal Barnard's book, Foods That Fight Pain, we were talking about the blood supply to the discs in the back being cut off by clogged arteries to those discs and vertebrae. Now, discs are there to cushion the vertebrae from touching each other, so it's not bone on bone, and also have a space for the nerves to get through. Now, when the tough outer layer of the disc, which is like leather, disintegrates, it lets the soft inner part squish out, and sometimes whole discs are destroyed. So what can be done? We'll get to that after I introduce this first group of stretches. In this stretch, you want to sit in a neutral position. It does not have to be a swivel chair, any chair. With one hand, grab the bottom of the seat. Twist in the opposite direction as you breathe deeply. You want to feel the stretch in the side of your waist and in your low back. Inhale, exhale as you come back, and then go to the other side. You want to do 5 sets of these. For an added stretch, grasp both hands on the same side as you twist. Whenever you stretch any part of your body, you never want to stretch to pain, but it's best to stretch to the edge of comfort. You are following along, aren't you? Well, getting back to foods that fight pain. Researchers asked, is it possible for arteries to the back unclog themselves without anything invasive? By the mid-1990s, they already knew that arteries to the heart could unclog themselves by changes in lifestyle and diet, and that also arteries to the legs could restore themselves by these changes in diet and lifestyle. Could the same thing happen to the back arteries? Then it was proven without a reasonable doubt that the arteries to the heart could clean themselves out by changes in lifestyle, by changes in the diet, avoiding smoking and excess stress and sedentary habits, that the arteries would start to clean themselves out. Who knew that what you eat could have a factor in back pain? And who knew that the same heart-healthy diet, low fat, avoiding saturated fats, low cholesterol diet, could also help the back? Before mid-1995, even orthopedic surgeons had no clue. And you just don't wake up with clogged arteries one day. They build up over years and years. In fact, in some cases, as young as 10 years old, they begin. As it turns out, 1 in 10 people in the Western countries has advanced blockages in one or more artery by the time they're 20. Now we will go on to the last stretch that I will show you in this video, although there are many stretches for the back. In this stretch, you want to hold on to the seat on one side and stretch in the opposite direction with your whole side of your body, your other hand reaching toward the floor below. Breathe deeply as you do. You don't want to be leaning forward or backward, and you want to have your buttocks firmly planted on the seat. You should feel the stretch in the side of your low back, the entire spine, the side of your neck, and also your shoulder. Let me just say that the book Foods That Fight Pain is not primarily about back pain. What we eat can cause all kinds of disorders, and what we eat can also reverse many disorders, or at least reduce their pain. Some of the things he talks about are chest pain, clearing out your arteries, migraines, headaches, joints, digestive problems, fibromyalgia, menstrual pain, carpal tunnel syndrome, diabetes, herpes and shingles, sickle cell anemia, kidney stones, urinary infections, and more. I'm going to read something from the book that I think is very important to know, because sometimes someone will tell you about a treatment that is natural and inexpensive and you can get it in your food store, but you dismiss it because if that were true, my doctor would tell me. And that may not be the case. So I'm reading from the book, quote, "Unfortunately, your doctor is not likely to tell you and may well not know most of what you will read in this book. In treating pain, many doctors rely on a restricted range of treatments, while vital research showing what is actually causing the problem and how to correct it often gathers dust in medical libraries. The fact is, when a shiny nugget of potentially life-saving information appears in a medical journal, few doctors will ever see it. For even the most conscientious doctors, it is a challenge to keep up with more than a few of the thousands of journals that appear every month, even though the very answers we are seeking might be found there. Only a handful of these journals ever publicize their findings in the popular press. The vital information they hold is simply buried in medical archives. Of course, it is a very different story when a research study favors the use of a new drug. Then the drug company will hire a public relations firm, pay for massive mailings to physicians, and advertise in medical journals. The company will sponsor medical conferences that highlight the role of the drug and pay speakers to discuss it. Drug companies motivated by potentially millions of dollars in profits are skilled at getting a busy doctor's attention. But no industry makes money if you stop eating a food that causes your migraines. No surgical supply company makes a cent if you open your arteries naturally through diet and lifestyle. A pharmaceutical company's bottom line does not improve if you use natural anti-inflammatory foods instead of expensive drugs. And without the PR machinery paid for by industry, some of the most important findings never make their way onto a doctor's desk. Patients with arthritis, migraines, menstrual cramps, or even cancer who ask doctors what they should be eating to regain their health get no answers, simply because no one has brought new information to the doctor's attention." Unquote. And although it is still the minority, more and more doctors are incorporating nutrition into their practices instead of just, "You've got a problem, I'll give you a pill." And that is their only treatment option that they know of. Well, you can check that out for yourself. I've got a link in the description below. And it's one of several books that he's got. Some you may be able to find at your library. They include books on reversing diabetes, restoring your liver, weight loss, and more. Now, I've added this commentary to the video not only to give you information, but because watching me is obviously boring, and I'm not that pretty to look at. You can tell me in the comments below whether you like that type of thing or not. But I think in the future, I'm not going to do this. I've got a lot of stretches I want to show, not only for the back, but the neck and other parts of the body. And I think it would be best if I just show, this is the stretch, this is what it does, and how to do it, and do this 5 times or 10 times or whatever, instead of having you follow along. And don't feel that because you don't have time to do the whole set or the whole routine, even a few repetitions on the warm-ups or the exercises will benefit more than not doing anything at all. And anytime you have a few minutes, you can do stretches, not just these stretches, but any stretches for wherever it is stiff in your body. Stretching helps relieve muscle tension, increases circulation in the muscles, helps prevent or alleviate pain, and also helps with your mental stress. Well, I hope you got some benefit from that video, and I hope you will continue doing them. And in the next video I will put out will be just stretches for the back, but you want to do your warm-ups first, and I'll just briefly go over the warm-ups in the next video, but I won't go through them step by step by step. I'll just give you a refresher, and then we'll do some different back stretches. And please leave a comment below, tell me how your back is, and I've got some information in the description that may be interesting to you. So subscribe, like it, all that good stuff.